Hi friends. See the next Nclex question. We are straight away going to a question. So the question is that you are completing a discharge education to a patient who is going home who had aortic valve replacement with mechanical heart valve. Think mechanical heart valve, not biological. Okay, mechanical heart valve. Which statement by the patient that your teaching was effective? So you are taking a feedback from your patient, and patient says this points to you, and you are making a conclusion that the patient understood what was taught to him. Okay, so let's see what he says. In the first statement, he says that I am glad that I can continue taking my Jingo biloba. Okay, Jingo biloba is a what is that? It's a herbal preparation which causes increased bleeding. Okay. So the second option is I will increase my intake of leafy green vegetables. Leafy green vegetables have lots of vitamin K in it. So what it has? It has anticoagulant effect. Okay, so that causes increased clotting. Okay, I will start applying vitamin E to my chest incision after showering. That's a study. So definitely this patient will have an incision on his chest, and he says that he is going to apply vitamin E. Okay, then the fourth option is I will shave with an electric razor from now on. So he's telling he is not going to use the razor blade one, he is going to use the electric razor. So let's see how each one of the options are. This one is only one answer you have to choose, so how other three are wrong. Okay, so let's go. What is mechanical prosthetic valve? Let's go to that. Mechanical prosthetic valves are more durable than biological valves. Okay, so the life of this one has more than biological valves, but requires long-term anticoagulants therapy. Due to why they need a long-term coagulant therapy? Because there is an increased risk of thromboembolism. If you don't give anticoagulants, this patient had intent to develop more emboli. So the client should taught ways to reduce the risk of emboli. So when you send this patient home, you have to give a lot of teaching, because it's a new life modification in their life, because they have something artificially placed valve in their body. So how to maintain and take care and live a good life, because they are on medications which we need a therapeutic level of bleeding and clotting time for them. So teaching topics for this client on anticoagulants, they are take medication at the same time daily. So you have to teach them that take medication daily. Then depending on medication, report for periodic blood test to assess therapeutic effect. So they have periodically they have to do their blood work. Okay, so then they'll know is a therapy whether the drug has to be adjusted to increase or decrease, because you don't need a long of course with the therapeutic range, of course the bleeding time will be more and clotting time will be means also prolonged. So in that case we need to achieve a therapeutic level, so they should do periodic blood test. Then they avoid any action that may cause trauma, injury, and lead to bleeding. So, like you contact sports, vigorous teeth brushing, use of razor blades, these all things may make a small cut, the patient may bleed for longer time. So, all those things to be avoided. Okay, avoid aspirin and NSAI, non-steroidal anti-inflammatory drugs, NSAIDs. Okay, so these drugs should be avoided, like aspirin, non-steroidal anti-inflammatory drugs. Then limit alcohol consumption. These are you should give information to this patient who is taking anticoagulants, should be given these informations. Okay, then other things is avoid changing eating habits frequently. Example, dramatically increasing intake of food high in vitamin K, such as kale, spinach, broccoli, greens, etc. So that was our second option here. He said he will increase intake of leafy green vegetables. What happens when he eat too much of that one? The level of vitamin K will increase, then it will make more, means the therapeutic effect, what anticoagulant, it will reverse, the effect of anticoagulant will reverse. So we don't want this patient to eat too much of green leafy vegetables, so moderation. Okay, then other, consult with the healthcare provider before beginning or discontinuing any medication or dietary herbal supplements. Example, ginkgo biloba and ginseng affect blood clotting and may increase bleeding risk. So first thing he said, he is glad to take his ginkgo biloba. So that what it causes? It causes more bleeding. Already you are going to put this patient on the therapeutic level of medication, and instead of, plus on top of that, if he take these substances, this herbal stuff, it is going to make the bleeding time more prolonged and he will bleed. Okay, and he may end up with other problems. So, and when he is going for any other treatment or increasing or decreasing, any modification he is going to make on medication, he should consult his healthcare provider. Then wear a medical alert bracelet, so that if you find this patient somewhere unconscious or a mental accident or something, if he has a bracelet showing that he is on anticoagulant and or diabetic, whatever medical bracelet the patient is having, that makes the medical team easy to start treatment for this one. Without knowing, it is difficult, because then we are going to waste time to give care for this patient. So that also help. So medical alert bracelet has to be in place all the time, so and indicating that the patient is on anticoagulant. Okay, then let's see option 3, early in recovery period. Care of incision site to typically include soap water, washing with soap and water. He said he is going to apply vitamin E, so that he can do in, so when so early in recovery period, care of incision site typically include washing with soap and water and to patting it dry. That is the early stage he has to do. Ointment, example like vitamin A, may be applied after the incision has healed, not during the period of his healing. After it is healed, he can use vitamin E. Okay. So in this patient, educational stuff, what we can do, client who are on anticoagulant should avoid aspirin, NSAIDs and other over-the-counter herbal products. Example, ginkgo biloba, that can increase bleeding risk. They should also avoid behaviors that increase the risk of clotting. Example, eating excessive green leafy vegetables. Okay, let's go to the next question. So you are the nurse identified which risk factors are contributing to the development of peripheral artery disease. Select all that apply. This question has more weightage. So it's a SATA question. So you will get one or more options correct from this. Okay. So let's see peripheral artery diseases risk factors. So first risk is cigarette smoking, second is diabetes mellitus, third is hyperlipidemia, fourth is oral contraceptive use, fifth is prolonged standing. So let's go option one by one. Okay, now in peripheral artery disease, what happens is, to the periphery, to the lower extremities, the blood flow decreases. Okay, how? Because in the artery, peripheral, in this one, atherosclerosis develop. So the narrowing, thickening takes progressive thickening and hardening due to chronic vascular damage. So the vessels towards the lower extremities, they progressively they damage, they become thickened and hardened. So due to that, what happens is the blood flow towards that blood vessels will decrease. So when that happens, so there are other symptoms you can see is, you will see hair loss in lower extremity, hair loss you will see, and intermittent claudication. The patient is exercising, even patient at rest will feel that ischemic muscle pain they will have, even walking, even at rest you will feel, and this extremity will be cool, dry, shiny skin. Then you can see peripheral, the nails will be thick and brittle, and you can see ulcers. Then more advanced form you will see gangrene, means that maybe the toes, they gangrenes, that they have to be amputated, like that severe situation that can cause. So in peripheral artery disease, the arteries of the extremities become atherosclerotic, progressive thickening and hardening due to chronic vascular damage. Peripheral artery disease reduces tissue perfusion and can cause ischemic pain of the lower extremities with movement of exercise, intermittent claudication. Pain with pad can also occur at rest, and manifestation in the lower extremities as burning. Patient will feel burning, aching, and numbness. Factors that cause ischemic vascular changes and increase the risk of pad includes. So now we are going to our question. Okay. So the risk factors: hypertension. How hypertension is contributing? Vessel damages from chronically elevated vascular resistance. So peripheral vascular resistance, when it increases, what happens? The blood pressure go high. Okay, that is one risk factor, but it was not given here. But that hypertension is a risk factor. Then diabetes mellitus, that is there in our option. Second option was diabetes mellitus. The inflammatory vascular changes from hyperglycemia. When the patient become hyperglycemic, the sugar level go high, so they develop inflammation. That inflammation will inflame the blood vessels and narrow, and the blood circulation to the extremity will be less, and that will cause that is one of the risk to become PAD, peripheral artery disease. Then hyperlipidemia, how it is contribute is increases the plaque inside, plaque formation inside, and then atherosclerosis forms, and that contribute for PAD. Then smoking in the people who smoke, they will have chronic vasoconstriction from nicotine inhalation. So they are taking nicotine, and that will cause vasoconstriction. The vasoconstriction means less blood flow to the extremity, that causes also. So those ones are the risk factors contribute to peripheral artery diseases. So the option which is not correct is elevated estrogen level, like oral contraceptives or pregnancy or hormone replacement therapy make blood more hypercoagulable. However, elevated estrogen levels are more likely to form thrombin in veins than in arteries. So this in the veins the pressure is less. So when sitting for a long time, you'll see there is chance for clot formation. Okay, so DVTs like that can happen with estrogen therapies or like that, but not peripheral artery diseases. Arteries, the pressure is more, so less chance of forming thrombi in arteries are less. Okay, the atherosclerosis, they become thick because of the plaque deposit. So the lipids are deposited and plaque formation. So that is so slower blood flow. Example, venous stasis takes place. Then DVT like that happens in elevated estrogen levels. Okay, option number 5, like chronic venous insufficiency, in which vessels ineffectively return blood from the feet to the central circulation. Standing is not a risk factor. So prolonged standing, we said is a prolonged standing. No, with the prolonged standing, what happens is the blood due to the gravity, the blood flow towards the lower extremities. So that is not a risk factor. So the risk factors here are, first risk is cigarette smoking, as we said, is vasoconstriction takes place. Diabetes mellitus due to inflammation, that also is a contributing factor. And hyperlipidemia, as we deposit the lipids in the vessels, then plaque formation. And fourth one was oral contraceptive, that is no. Then prolonged standing, that one also no. So 3 out of 5 were correct here. Cigarette smoking, diabetes mellitus, hyperlipidemia are the contributing risk factors for peripheral artery diseases. Now, now let's go to the third question. The nurse is performing a cardiac assessment. Okay, so now where you will locate for finding the point of maximal impulse, that means apical pulse, where you will locate the apical pulse. Okay, so you have to look apical pulse. Apical pulse or PMI is called as apical pulse, the same. It reflects the pulsation of the apex of the heart and should be felt medial to the middle clavicular. So clavicle here, and the midline is going towards the. You can hear that in between the fourth and fifth intercostal space. Okay, that is the right place where you will hear the heart sound, apical heart. Okay, apical pulse. So if you are hearing it's below the fifth intercostal space and more towards the left, that means this patient is having heart and cardiac enlargement, because the heart has become enlarged and it is moved. The apical pulse, the site is moved. So that is what the assumption is. So if it is the right space is midclavicular space between the fourth and fifth intercostal space, that is the right place where you will look for your PMI or apical pulse. Hope you enjoy this. We'll see you with some other questions in next video. Thanks for watching, guys.